Thanks, Sue, and thank you for inviting Birthrights back on Midwifery Hour. We're always very happy to be here. As Sue's explained, it was supposed to be my colleague Francesca who was speaking about this tonight, but as Francesca's not feeling that great, I'm afraid you've got me instead. But really happy to have the opportunity to share this new film with you. Next slide, please. So for anybody who's not familiar with Birthrights as an organisation, as Sue said, we focus on improving maternity care through a focus on human rights. We were founded in 2013 by Elizabeth Prohaska and Rebecca Schiller. So coming up for our 10th anniversary very soon. We do a number of strands of work in our day-to-day kind of activity. The first strand of work is that we offer resources and legal information and advice to anybody who's pregnant or has just had a baby, or indeed to healthcare professionals as well. So anybody is welcome to look on our website. We've got a new set of fact sheets up there, or a revised set of fact sheets that were made even more accessible and inclusive this year. So they're free to access, available on our website for anybody. But if anybody wants some more specific advice about a situation they're facing, they can also contact our email advice service on advice@birthrights.org.uk. And as you can imagine, demand for that service has gone up exponentially during the pandemic. So yeah, we've certainly seen a big increase in inquiries. So as well as running that advice service and producing those resources, we also offer training to healthcare professionals. So we offer our own training. It used to be all face-to-face, but obviously during the pandemic, we've made the shift online, and now we're offering both formats. So we offer that to any trust or any RCM branch, for example, or any other organisation who wants to commission it. And from time to time, we offer ticketed events where individuals can sign up to that training as well. And we use what we learn from working really closely with pregnant women and birthing people and with healthcare professionals to inform everything else that we do. So whether that's research or policy or campaigning work, we also do legal interventions. It all stems from that base of understanding what the issues are with people who are using the service and people who are running the service. So one of our flagship pieces of work at the moment is an inquiry into racial injustice. So that started at the beginning of this year. It's due to report in March. And it's led by an expert panel, chaired by a senior barrister, and it's co-chaired by a service user and also a healthcare professional. And it's largely a group of Black and brown women who are really passionate about making a difference to these inequalities that are faced by Black and brown women when it comes to maternity outcomes. So we're really looking forward to publishing the results of that inquiry in a few months' time. We've also done a lot of work over COVID, challenging visiting restrictions, for example, and some of our previous work has been focused on women facing severe and multiple disadvantage. We've published some research with Bournemouth on women who have a physical disability and their experience of maternity services. And we've also done things like a maternal request cesarean campaign. So if you want to find out anything about our past projects or our current projects, then there's more information on our website. Next slide, please. Well, I'm here tonight to talk about our most recent project, which is a film called Speak Up, Speak Out. It's a film about making a complaint. So 1 in 5 inquiries into our advice line is people asking us how they go about making a complaint. It was only released a few weeks ago, and it was actually funded by some donors who've had a bad experience of maternity care and wanted to use that experience to do something constructive. So we're really grateful to them. And the aim of this film is really to encourage people to speak out about their experience, because that's the starting point of making a difference and making a change. So we're really conscious that over the last 18 months, it's been a really turbulent time in maternity services. And we know that maternity staff and midwives in particular are really burnt out and exhausted and leaving in significant numbers. You know, I was on the March for Midwives as well a couple of weeks ago, and it's really hard to hear about the experiences that staff are are going through right now. And so we're really conscious of that angle, and we have written to the Secretary of State for Health and Social Care, asking the government to accept the Health and Social Care Committee's recommendation that they increase their investment in maternity services by 200 million to 350 million extra each year, because it's really important that maternity services have enough people and have enough resources. That is going to be the basis for respectful care. But I think there's also this undercurrent during the pandemic where people were feeling that everybody was under pressure, that services were doing their best. It was a pandemic, it was unusual circumstances, and perhaps it wasn't right to complain, it wasn't right to make a fuss. And we really felt this video was important because we want to give the message that no matter what's going on, that feedback is really important. And it's really important to give positive feedback as well as negative. That really helps to boost morale. But where people have had quite a traumatic time, as many women have during the pandemic, due to visiting restrictions and changes to maternity services, it's really important that services hear that. That's the start of the learning curve, and it also helps trust to build the case for further investment in maternity services too. So yeah, we're really excited to present this film. It's really important to say that the people in the film aren't actresses, they're real women telling their own stories. And this film was informed by a focus group, and we really tried to make sure that that was as diverse as possible. So it included Black and brown women, families from the LGBT plus community, and we also heard from women over the phone and by email. So it was informed by a really diverse group of families who'd recently had a baby. And this film features their stories. So Maya, Leah and Haral, who were featured in the film, came along to the focus group and agreed to be filmed. And I'd also just like to give a big shout out for Farial Valmi, who was our screenwriter and filmmaker, and I think has done an absolutely fabulous job with this film. So we're really grateful to her and to Francesca, who also did a great job of leading this project. So I'm going to show you the film. I hope you enjoy it, and really hope we can have some discussion about it afterwards.
We have a right to receive safe and appropriate maternity care
that respects our fundamental human dignity.
We have a right to privacy and confidentiality,
to be free to make choices about our pregnancy and childbirth,
even if our caregivers don't agree with them.
Everyone has a right
to equality
and freedom from discrimination. I was in the labour ward and I kept telling the midwives I didn't feel well. I was shivering and feverish, but I just wasn't listened to. I wasn't believed. When my condition deteriorated badly, I was finally taken seriously. It turned out I had sepsis. I was rushed in for an emergency C-section. My baby had sepsis too and was taken into intensive care. I was in hospital for 2 weeks, and the care I received was so poor. Because of COVID, my husband couldn't be with me for long. It was a really difficult time.
Whilst I was in the birthing pool, I noticed a real shift in my body. I tried to explain to the midwives and doctors that something was wrong, but nobody would listen. I had a number of procedures done without my consent. Nobody informed me of what was happening. I felt like I was on a conveyor belt. It wasn't until after the experience that I realised that I'd suffered from birth trauma. It massively impacted my mental health until I sought help from other people and educated myself.
I had planned a home birth, but this time I sensed that something wasn't right. I knew we needed help, so I came into hospital. I kept telling them that I needed a C-section, but they kept on refusing. Only after 5 hours of pleading did they take me in. After my baby was born, he needed resuscitation. It was awful.
I didn't realise I could make a complaint about the care I received during my pregnancy.
Or about something that's gone wrong during labour or on the postnatal ward.
Starting off, I went on the Birthrights website and saw that I needed to contact the Patient Advice Liaison Service, or PALS.
I then made a formal complaint to the hospital trust.
It's hard to remember everything, especially when you have a newborn baby to look after and you're totally exhausted.
I remembered things in fragments, but that's okay, that's normal.
You don't need a long official letter. Just a few simple bullet points of what happened is enough.
I recorded voice notes on my phone of what was happening.
Birthrights helped me decide on the most important points to include.
In my complaint, I said I wanted an apology for everything that happened to me and for better training.
My partner wrote down a witness statement of what he saw.
I made a complaint because I wanted a change in hospital policy. How else do we hold people to account? I became seriously ill, and that should never have happened. For me, it's also been about educating my family that it's okay to speak out. It's something positive.
As a black woman, I feel more of us need to say when things go wrong because we are discriminated against, and that needs to be challenged and stopped.
I want to make sure that others don't have to go through what I did, that we are listened to and believed.
If we are not treated with dignity and respect, we can do something about it. It's as simple as that.
Okay, so I hope you enjoyed seeing that film. I think it's be really interested in your feedback. It's interesting that black and brown women, the evidence shows, are even less likely to make a complaint than white women. So we're really pleased that we could feature some of the stories of Maya and Leah and Hiral in that film. These are some of the comments we've had on social media about the video. So we've had some really nice feedback that people welcome the film and have been taken aback, and that it's really good to hear the stories of the women featured in the film, and that saluting their bravery and courage and talking out. So that's been really good to hear. But really look forward to discussing further and to hearing your feedback as well. So thank you very much for listening.
Thanks for watching this video from the Maternity and Midwifery Forum. For more expert opinion and analysis, hit the button below to subscribe.